Hi, this is Dr. David Greene, founder and CEO of R3 Stem Cell, the global leader in regenerative therapies. Today I'm presenting to you the IntelliCell, a smart stem cell that we've been working on for years that is now available for patients and is resulting in effective, cost-effective, and very safe outcomes around the world for our patients. So I'm going to talk to you about what exactly a stem cell is, the types that we use for therapies, the different variables to consider, how to create a smart stem cell. Is it cost effective? How does it compare to what other international clinics offer? And what is the pricing at our international clinics? So who is R3 Stem Cell? Well, I created the company over 10 years ago now. We've won a lot of awards over the last few years. We have clinics in over 8 countries now. There's closing in on 50 clinics. We've done over 17,000 procedures in that last decade. We've been in Mexico for 4 years now. We have clinics in Tijuana, Cancun, Mexico City's in construction. We treat over 70 different conditions. We've had no significant adverse events globally. We are always on the cutting edge of regenerative cellular technologies. We recently won the top biotech startups this year from Life Sciences magazine. What exactly is a stem cell? Well, there's really 2 defining characteristics. They're able to self-renew, which means they can replicate through mitosis, and they can differentiate. They can turn into a number of different cell types. I'll show you what that means here in a moment. So what are the different types of stem cells? All right, so when you look at the classifications on the left side, it breaks it down into the source of origin. It's either embryonic or adult. We don't use embryonic stem cells. I'll tell you why in a moment. We only use adult stem cells, but that doesn't mean they come from an adult always. So keep that in mind. I'll explain that in just a second. Now, the action potential of a stem cell could be anywhere from totipotent, which means they can create any type of cell in the body, and the embryo and placenta if they needed to. Pluripotent means they can create any type of cell in the body. Multipotent means they can create a number of cell types in the body. And unipotent means they're only destined for one cell type. So when you look at what we're using, source of origin, we don't use embryonic. Those are the ones that come from aborted fetuses. We've never used those. They're not ready for prime time use. We use adult stem cells. Adult stem cells can be the ones that actually come from an adult, either bone marrow or adipose. We don't use those. We use ones that come from the umbilical cord. I know it's weird, but umbilical cord stem cells are considered adult stem cells for these classifications. Now, action potential. The only way to get a pluripotent or totipotent stem cell is from an embryonic stem cell. We don't use those for ethical and safety reasons. So we're talking about multipotent stem cells, and I'll explain to you how those work just great. So postnatal tissues contain stem cells that are considered adult. Okay, I just explained that. Umbilical cord, amniotic, other stem cells from the placenta, they are considered adult stem cells. All right, the predominant cell type within these adult stem cells that we're using are called mesenchymal stem cells, MSCs. Okay, some people say mesenchymal, others say mesenchymal, but MSCs are what we are predominantly using. And I say predominantly because we also have some hematopoietic stem cells, but not embryonic. Okay, so when you look at multipotent stem cells, we're talking about mostly mesenchymal and a little bit hematopoietic. Okay, now MSCs, here's just a sampling of what they can possibly turn into when they differentiate. Could be heart, bone, cartilage, cornea, liver, muscle, nerve, fat. Renal cells are also in there. You know, the list is not complete there. All right, so older adult mesenchymal stem cells, such as those that come from an adult from the bone marrow or adipose tissue, are problematic in the sense that they're more likely to have accumulated cellular damage. A lot of the stem cells that we have as we get older, they get older with us. So they have a less vigorous response to injury. You can only use them for yourself. You can't use an adult stem cell in, someone else. And they're scarce. As we get older, the bone marrow really drops off in its ability to create stem cells. So it goes from 1 in 10,000 cells in your bone marrow as a stem cell down to 1 in 2 million. So it's a 200-fold drop in what's available to use. Contrast that with postnatal adult mesenchymal stem cells, which come from either the placenta, the amniotic fluid, the umbilical cord, which is what we're using. You can see the umbilical cord on the right. This is a cross section. The umbilical cord has 2 arteries and a vein. Okay. The material in between all of that is called Wharton's jelly. So you may have heard that term, Wharton's jelly, named after Dr. Wharton back in the 1600s. That is where we get our mesenchymal stem cells. All right, it's a very, very active source of mesenchymal stem cells, so that's what we use. Now, these stem cells from the postnatal tissue are very robust. They're very young and active. They have not aged with us, so to speak. They're new and fresh. They're less likely to have accumulated genetic errors, mutations. All right, not the same as a mature adult as far as activity goes. And they are immune privileged. They don't have MHC2 markers. They are not going to get rejected. And they're very plentiful. 1 in 10,000 or more is a stem cell. All right, so let's look at some variables to consider when you're looking at stem cells for use. Where do they come from? Are there any ethical challenges to that source? Are they safe? Are they pure? Or are there a bunch of, mutations and other defects that might make them non-functional? Are they potent? Do they actually have the incredible amounts of activity that we want them to? Are there enough of them? And are they alive? Are they viable? So I'm going to do this in a face-off format where I look at umbilical cord stem cells versus the other alternatives. And we'll see who the winner is at each category. All right, source. Umbilical cord stem cells are obtained after a scheduled C-section. The women who are donors are screened heavily. They're under the age of 35. If they've had a tattoo or a history of vaping or smoking or drug abuse, they are excluded. And when they have the scheduled C-section, it's very straightforward. The baby's fine, the mom's fine, and the umbilical cord, instead of getting discarded, goes into a sterile container and right to the lab. Now, when you look at embryonic stem cells, the way they're acquired is from aborted fetuses. And when you look at what happens to an embryonic stem cell when it gets, when a patient is treated with them, immediate rejection occurs. It can be fatal, and they can form tumors. A lot of times they don't know when to stop replicating, and that can be a problem. The umbilical cord stem cells do not have that issue. They don't get rejected, and they don't form tumors. That's been shown in many studies. Autologous stem cells don't have those ethical issues or the rejection issues, but there's just not enough of them, by and large, from bone marrow. And even if there were, like, for instance, our fat tissue has a lot of stem cells up until we die, they're not active enough. A lot of them have aged with us. They get pretty lazy. They just don't have the activity that the umbilical cord stem cells do, and they require a harvest. There has to be either a liposuction or a bone marrow aspiration. It does have a slight incidence of complications and pain. So why do we use umbilical cord stem cells? As I mentioned, the umbilical cord, once again, 2 arteries and a vein. We use the gelatinous matrix called Wharton's jelly around the vessels, they have very active mesenchymal stem cells. We culture the Wharton's jelly stem cells in a clean room. It's CGMP compliant. It's ISO certified. We keep the culturing to the 3rd generation or less. What that means is we culture them just enough so that they maintain their potency, their purity, and we have a really, really low incidence of any mutations or things like that. Those get screened out. So you don't have those issues like you do with the adult types of stem cells, or if you cultured them many, many, many times. That's one of the problems that our competitors have, is they will culture too much, and then the stem cells are not as active. We also derive our exosomes from the umbilical cord as well. Anybody who comes to, say, our Mexico clinic and receives 50 million or more stem cells automatically receives free stem cell exosomes. And our lab is certified by COFEPRIS, which is the FDA equivalent in Mexico. So the source winner is umbilical. It's much better source than either autologous, which requires a harvest, and as I mentioned, the stem cells are either not enough, they're not as active, and then embryonic, which has ethical and safety issues. All right, so let's talk about ethics for a second. With umbilical cord tissue, there are no ethical issues. You're not dealing with any aborted fetus. You're not dealing with any ethical issues when it comes to how the material is obtained. These women are scheduled C-sections, so there's plenty of time to get the consent form, to screen them. Otherwise, the umbilical cord gets discarded. So there's no issues there. Embryonic, yes, humongous ethical issue with the aborted fetuses. There's only like 2 places in the world that I know of that offer treatment with aborted fetuses. One's in the Ukraine, and I think there's another one possibly in Mexico that they don't advertise except for word of mouth. But, it's just something that we can't get past that. Plus the fact that, those aren't safe. Autologous, there really are no ethical issues. So it's really a tie between the umbilical cord stem cells and the autologous stem cells. So let's look at safety. We've done over 17,000 cases with umbilical cord stem cells in the last decade. We've never had a rejection reaction. We've never had a deep infection to date, knock on wood. And we've never had a significant adverse event. So what we have seen are mild to moderate issues, low-grade fever, temporary chills, headache, nausea, things like that. Embryonic stem cells are not safe at all. They will get immediately rejected from the body and potentially form tumors. Autologous, you don't have any rejection issues, as we said, but there is a slight risk with harvest. Could be an infection or whatnot, and possibly chronic pain. So the safety winner is definitely umbilical. Purity and potency. When it comes to the umbilical cord stem cells, this is one of those levers that you can pull, meaning it depends on how you process the umbilical cord tissue to make sure that it has, the purity and potency. Now, during our processing over the last few years, we've implemented selective cellular processing, where we use specific markers to make sure that we have mesenchymal stem cells that are very pure, and they have a lot of colony-forming units, which means they're very, very active stem cells. As I mentioned, we keep it to the 3rd passage or less to make sure we minimize any issues with non-functional stem cells or mutations or things like that. So we really have gotten it to where these are the most active mesenchymal stem cells available. Embryonic stem cells are very pure and very potent, but it's irrelevant because they're not safe to use. Autologous, you do have a lot of stem cells, for instance, in adipose tissue, but a lot of times those are as old as we are. They're not as active or responsive to injury. And a lot of times these stem cells have become senescent, meaning non-functional because they're older or they have mutations, and your body's very good at just turning those off. So embryonic wins as far as, theoretical purity and potency, but it's irrelevant. So umbilical takes the gold because not only are they pure and potent, but they're safe and ethical to use. All right, quantity and viability. So we know that stem cell counts matter a lot, and I'll show you that in the slide coming up. With our culturing methods and our bioreactor, the quantity of stem cells with colony-forming units is absolutely incredible, and it's very cost-effective. Okay, I realize that's not the what we're talking about, but I thought I'd mention that. As far as viability goes, we don't use cryopreservative in most of our international clinics, so there's no issues with viability. We're at about 98% on average. Embryonic stem cells, yes, you do have the unlimited ability to culture. You can get unlimited quantity and viability, but as we've been discussing, that's irrelevant because they're not ready for use. Autologous bone marrow stem cells drop in quantity tremendously as we age. They drop 75% by the age of 50, 95% by the age of 70. It does not make sense to use those ever, in my opinion, except in a case of cancer or something where you're doing a true bone marrow transplant. Now, adipose stem cell counts are actually excellent as we age. However, the viability with treatment is way down. Once you remove them from the body with the liposuction, then you process them and reinsert, there is a viability issue. You're not going to get 98%, that's for sure. You're not even going to reach 50%. So the purity and potency winner is a tie between umbilical and embryonic, but it's irrelevant. Umbilical is the clear winner because embryonic's not safe. What makes the IntelliCell creation better? So we've talked about how umbilical cord stem cells are superior to other sources, but what about the IntelliCell? All right, so first of all, I want to mention that safety at our Mexico clinics with our biologics is equitable to FDA standards. So this is therefore a non-factor. People ask us all the time, is it safe to receive these biologics in Mexico? The answer is absolutely. We've done so many cases over the last years that have been very safe. We have a very high quality assurance standards with our testing for communicable diseases, pathogens. Our clinics themselves, Tijuana is part of an ambulatory surgery center. Cancun is part of a hospital. Very, very clean and clear as far as the quality assurance and controls in place. All right, so let's go through the 8 ways that the IntelliCell is superior and smarter than anything other stem cell clinics internationally are offering. First of all, we're very keen on our cellular selection process. Some of this is proprietary, but rest assured that we are looking at markers to make sure these are very pure mesenchymal stem cells that have colony-forming units galore, which means they're very, very active stem cells. They don't just look pretty. They have a lot of function, so form and function. As far as our culturing goes, we're very careful with keeping our culturing. One, you have to culture to keep it cost effective and to get the amounts of stem cells that we need. 2 is you have to be careful with how much you culture because you don't want them to become non-functional, get mutations, things like that. So as I mentioned, we keep them to the 3rd generation or less. Viability, we don't use cryopreservative. We only use just cold packs. So these stem cells are viable for 72 hours once they come out, and they get flown over to our centers right away. So we use them within 24 hours, so a lot of time to spare. These stem cells are great at seeking out where they are needed. What this means is that they will seek out areas of inflammation that are either acute or chronically diseased. So if someone comes in and they're suffering from diabetes, type 2, let's say, and they have an issue with the pancreas, obviously, the pancreas is going to be giving off inflammation. A lot of stem cells are going to go to that area. However, people with diabetes type 2, if it's not really, really well controlled, they can also have issues with kidney failure, issues with the eyes, issues with the heart. So those areas are also going to be giving off inflammation. So it's very important that those stem cells are able to find where they are needed to go to the appropriate location, right? Now, once they get there, you want them to be able to differentiate into the cells that are needed. So it's very important that you have tested for colony-forming units to make sure that those are very active stem cells, and we have. Years ago, we tried stem cells that were pre-differentiated, like, oh, we want a lot of liver cells, so let's push them down the hepatic lineage. That does not work better than if you just keep the stem cells multipotent. Why? It's not clear, but we have tested that, and it's better to have cells that have the MSC markers and the CFUs so that they are just better as far as what they're responsive to. Persuasion. Persuasion is key because a lot of the ways that stem cells act are by cell-to-cell communication. So it's important that stem cells are able to persuade other cells to jump into repair mode, regeneration mode, and participate in the healing process. In addition, the stem cells are actually very good at persuading cells from other areas to come in and help. That's called chemotaxis, okay? So that's very important as well. And these cells are fantastic at persuasion. 7 is promoting. You want to be able to promote cells in the area to jump into action, as I mentioned. You want to be able to promote them to go into action for healing effects, and you want to promote translation of genes and proteins, to help heal damage. But you also want them to be able to stop as well. So that's one thing about these smart cells, is that they're able to promote, but then stop so that they don't over-replicate or form tumors, right? So thankfully, these smart stem cells, IntelliCells, are non-tumorigenic, while at the same time having amazing repair and regeneration effects for patients. Do the numbers of stem cells matter for treatment? They absolutely do matter. If you look at clinical trials over the last decade for stem cell therapy, they've shown without a doubt that to a point, higher numbers are better. And what I mean by to a point is that at a certain point, it might be too much for a patient to use in one treatment. So depending on the condition, what we offer, we have about 30 different protocols, but it could be anywhere from 1 million stem cells per kilogram to 5 million stem cells per kilogram, depending on the condition. That is not available cost effectively in the United States most of the time for patients who have serious conditions. So for instance, for a kidney failure, you may end up needing 2 to 3 million stem cells per kilogram. If you're 80 kilograms, that's going to be, 200 million stem cells. And we're going to do that in 2 to 3 sessions in Mexico very cost effectively. Our educated guess over the last 10 years is that anything more than about 100 million stem cells per session is ill-advised. If you need more than that, we will break it up so that your body can tolerate it better and incorporate those stem cells. So why consider R3 stem cell for your regenerative care? Well, outcomes. Year over year, we have an 85% patient satisfaction rate at the 1 year point. Over 35% of our procedures in Mexico right now come from referrals. And I think that just speaks to how great our outcomes are. We also get a lot of repeat patients who do well for, let's say, a couple years and they want to get done again. Our service. We provide a VIP escort where we will transport you from the airport or your San Diego hotel to the clinic in Tijuana, or from the airport or your Cancun hotel. Our experience, we have over 30 protocols, very experienced providers who've done many thousands of procedures in the last decade. So our safety is unparalleled. And then the IntelliCell itself. Most of the magic happens at the lab because that's what's, the protocols are very important. But when it comes to, what the cells are going to do in your body, you want to make sure that you have the most pure and potent, safe biologic going in, and the IntelliCell is exactly that. So how did we come up with our pricing? Well, for years now, my goal has been to put together the Mercedes of stem cell treatment for the pricing of a Ford. Nothing against Ford. Actually, the van that we, passenger van that we have to take you to our Mexico clinics is a Ford, but we want to give you the Mercedes of the treatment for pricing that's very cost effective. Due to our economy of scale and our high volume around the world, that's exactly what we've done. And that includes our investment into the IntelliCell biological treatment. Our mission is to make effective stem cell therapy available to virtually everyone in need around the world. And here's the issue is that most likely you're going to need a repeat treatment at some point. It may be a year, it may be 3 or 4 years. But what good is it if you've paid $25,000, $30,000, for instance, to go to, let's say, Panama, if in fact you're going to need to go back? Not everybody can afford that. Most people can't afford that. So, our treatments are about a third of that. Very cost effective, very, very high quality with the IntelliCell in our experience. The only extra fees that we charge are for when a patient needs sedation with an anesthesiologist, or intrathecal application, which is into the spinal cord, or a spinal procedure itself, intradiscal, epidural, or if there's extra days. So it's $500 US for the anesthesiologist. And for any extra days past the first, it's simply $200. These are not humongous fees. They're just pass-throughs directly to those entities and people. So right now we have clinics in Tijuana and Cancun. Mexico City is under construction. The process simply starts with a free phone consultation. There's no charge for it. We're going to set you up with one of our experienced stem cell doctors who will look at your medical records, reports, and see, if we can help you, and if so, what it will take, to do that. You'll have a dedicated patient concierge representative who will assist you with all your travel logistics, including travel from the airport to the clinic and back. We can help with flights and things like that. That's just, the patient responsibility as far as fees goes. All right, so just to give you an idea of our pricing. For 30 million stem cells, we're at $29.50. That in the U.S. would cost 3 times that. For 50 million stem cells, we're only at $39.50. And all procedures equal or greater than 50 million stem cells receive free stem cell exosomes. I don't know any other clinics that do that, but we think it's very important because the 1-2 punch of the stem cells plus the exosomes really improves outcomes. Once you go to 100 million stem cells, you get a break at $7,250. 200 million stem cells is only $12,250, which is about a third of the cost of Panama, Costa Rica, other countries. We even have a billion stem cell program. So most clinics offer stem cells that have been overcultured, frozen, not nearly as effective, not nearly as smart. They're not IntelliCells, they're dumb cells, or whatever the opposite of IntelliCell is. So R3, to get in touch with us, please call us on our U.S. number at 888-988-0515. Patients come from all over the world to our Mexico clinics to get treated. USA, Mexico, Europe, South America, Central America. And visit us online at stemcelltreatmentclinic.com. And tell the patient concierge representative that you watched this stem cell webinar, and you'll receive $250 off a treatment. You just can't combine the offers with any others. All right, thank you so much for watching. We look forward to helping you.